Mom, how do you feel now?
Achoo. I feel bad. I have a severe headache.
Let's go to the doctor.
No, Mom. I want to give time to our magical analgesic enkephalin.
Enkephalin.
Miss Cloud explained the transmission of pain message, and she said that enkephalins are natural analgesics that control our pain.
Nociceptors or pain receptors are sensory receptors that respond to damage stimulus. They are found in the skin, internal organs, muscles, and joints. For example, during injury of the skin, the nociceptors located inside the skin detect the damage stimulus and turn the stimulus into a nerve message. The afferent nerve here transmits the sensory nerve message to the spinal cord, which is the nerve center. Here inside the spinal cord, what's happening? When the nerve message or action potential reaches the synaptic knob of the afferent neuron, it stimulates the synaptic vesicles to release their content into the synaptic cleft. The content here is the neurotransmitter substance P or P substance. This neurotransmitter binds to its specific receptors on the postsynaptic membrane of the postsynaptic neuron here. The nerve message is transmitted from the presynaptic neuron to the postsynaptic neuron, then it propagates up to the brain where the pain is perceived. So substance P is called analgesic substance because it causes pain or pain sensation. In addition, it's called endogenous substance or natural substance because it's produced inside our body. In the spinal cord, we have an interneuron called enkephalin interneuron. The synaptic knob of this interneuron makes a junction or synapse with the afferent neuron coming from the skin and carrying the pain message. What's happening at the level of the synapse? An action potential or nerve message comes from the brain. When it reaches the synaptic knob of the enkephalin interneuron, the synaptic vesicles liberate their content in enkephalin into the synaptic cleft. Then the enkephalin binds to its specific receptors that are located on the postsynaptic membrane of the afferent neuron. So the exocytosis or the release of P substance or pain substance is blocked or inhibited. And the nerve message, the pain message, will not be transmitted from the presynaptic neuron to the postsynaptic neuron and will not go up to the brain, so no pain perception or sensation. So enkephalin is called endogenous analgesic. Endogenous because it is natural or produced inside our body. Analgesic because it blocks or inhibits pain. Substance P and enkephalin are called antagonists because they have opposite or different actions. Substance P causes pain while enkephalin inhibits pain.
Mom, my head is still hurting.
I am going to give you an analgesic.
Like enkephalin.
Yes. Analgesics are drugs that amplify the action of enkephalin, but they are artificial.
Can you give me examples of artificial analgesics?
Panadol, Advil and morphine.
What is the mode of action of morphine?
Take your medicine now, then ask your teacher about morphine.
Okay, dear mom.
In some cases, enkephalin alone reduces the exocytosis of substance P, so the pain feeling is partially blocked. So we have to take exogenous analgesics like morphine. Morphine is exogenous because it is produced outside the body or it is artificial. And it's called analgesic because it blocks pain. What is the mode of action of morphine? Morphine and enkephalin have highly similar spatial configuration or shape. Thus, morphine can bind to the same receptors as enkephalin. When morphine binds to these receptors, it blocks totally the exocytosis of substance P into the synaptic cleft, and thus it blocks totally the pain sensation. Enkephalin and morphine are two agonist substances because they have the same function. Both block the pain sensation.